Bold claim. The next big internet might not connect devices at all. It could link directly to our bodies, blurring the line between human and machine in ways that feel both miraculous and terrifying. Imagine the classic 1966 film Fantastic Voyage, where a tiny spacecraft and its miniaturized crew travel through an astronaut's bloodstream to fix a dangerous clot in his brain. That story felt like pure science fiction at the time, even after Isaac Asimov turned it into a novel. Yet the core idea, entering the body with ultra-small, ultra-smart technology, now echoes a real medical frontier: microscopic sensors that live inside us and connect our bodies to the internet. What is the Internet of Beings? This emerging vision is often called the Internet of Beings, and many researchers see it as the third, perhaps final, major phase of the Internet's evolution. First came networks of computers, then the Internet of Things linking everyday objects. The next step could be global systems that connect directly to human organs and biological processes. Scientists who recently gathered in Dubai at an event called Prototypes for Humanity argue that, from a technical standpoint, this scenario is moving from speculation to serious possibility. The implications are enormous for people, companies, and entire societies. On one hand, it opens up exciting new ways to prevent illness, treat disease, and personalize care at a level medicine has never seen. On the other, it raises disturbing questions about privacy, security, and even what it means to be human when our bodies are constantly online. But here's where it gets controversial. Are we ready to let the internet move under our skin? Dreams, fears, and hacked bodies. Turning our bodies into digital platforms triggers both utopian dreams and dystopian fears. Some tech billionaires imagine using such technologies to radically extend human life, nudging the age-old fantasy of immortality a bit closer to reality. Meanwhile, cybersecurity experts warn that if someone can hack your phone today, tomorrow they might hack your heart, your insulin supply, or your neural implants, risks that could make current cyber threats look minor by comparison. A forthcoming book titled Internet of Beings argues that this shift could bring at least 3 profound changes to medicine and healthcare. These changes touch everything from early disease detection, to active repair inside the body, to how scientific discovery itself works. And this is the part most people miss. The biggest disruption might not be the gadgets, but the way data flips the whole medical research model upside down. Consequence 1: always-on health monitoring. First, continuous health tracking could transform how diseases are caught and managed. Instead of going to the doctor once something feels wrong, tiny internal sensors could monitor vital signs, chemical markers, and other signals around the clock, spotting trouble long before obvious symptoms appear. Because treating a disease after it emerges is often far more expensive and invasive than preventing it, early alerts could shift healthcare from reactive to genuinely preventive. Picture your body sending you and your doctor a warning long before a heart attack, stroke, or diabetic crisis occurs. In the United States, hundreds of thousands of heart attacks happen every year, and a significant fraction are silent, meaning people do not recognize what is happening until it is too late. If embedded systems could flag abnormal patterns early and push timely alerts, many of these silent events might be avoided, potentially saving countless lives and reducing long-term healthcare costs. Consequence 2: from sensors to biorobots. Second, these devices would not just watch, they would act. It is increasingly likely that tomorrow's internal sensors will be more like soft biorobots, often made from gel-like or biocompatible materials, designed to move, respond, and intervene in real time. Instead of merely measuring a blood clot, for example, they could release a microdose of an appropriate drug, such as a clot-busting compound, precisely where and when it is needed. You can imagine similar systems that detect a viral attack and trigger a targeted response, like activating a vaccine or immune-modulating treatment at the earliest stage of infection. The breakthroughs in mRNA vaccines during the COVID-19 pandemic opened the door to programmable therapies that can be rapidly updated and tailored to new threats. Combining this with progress in gene editing tools raises a provocative possibility: microscopic robots capable of performing molecular surgery using tiny protein-based scissors to repair damaged DNA inside individual cells. Consequence 3. Research turned upside down. Third, and arguably the most revolutionary, the way new treatments are discovered could be completely reversed. Today's typical approach is hypothesis-driven. Scientists propose that a particular molecule might help a certain disease, then run costly, years-long trials to see whether they are right. In an Internet of Beings world, massive streams of real-world health data could flip this process. Patterns would emerge first from data, showing what actually works across populations, and researchers would then work backwards to explain the mechanisms. This data-first approach could make medical innovation faster, cheaper, and more precise. Instead of waiting decades for evidence to accumulate, algorithms might quickly reveal which combinations of lifestyle, medication, and environmental factors best address specific conditions in different people. That sounds powerful, but here's a controversial angle. If algorithms start discovering treatments before scientists understand the biology, how comfortable are we relying on black box solutions that we cannot fully explain? Beyond one-size-fits-all medicine. Healthcare is already shifting away from the old model where everyone receives broadly similar treatments for the same diagnosis. Precision medicine is moving toward therapies adjusted to a person's genetics, environment, and lifestyle. The Internet of Beings could turbocharge this trend, delivering day by day, or even minute by minute, recommendations tuned to subtle changes in your body, such as small fluctuations in temperature, heart rhythm, or sleep patterns. Instead of a fixed prescription, you might get dynamic dosing. Your medication amount or timing adjusts automatically as your body responds, much like a navigation app constantly recalculating your route based on traffic. Imagine waking up to a notification that suggests tweaking your exercise plan, hydration, or medication because your overnight data hints at increased stress or an early sign of inflammation. For some, this sounds like a dream of hyper-personalized care. For others, it might feel like being micromanaged by an algorithm. Rethinking how we study the body. The structure of medical research could change just as dramatically. Today, many studies isolate specific organs or disease categories: heart disease here, brain disorders there, foot and joint problems somewhere else. With huge data sets generated from people living their normal lives, researchers might uncover surprising connections. For example, discovering that certain kinds of headaches are strongly related to the way someone walks, or that subtle changes in foot mechanics influence brain function in unexpected ways. A key tool in this new approach is the concept of a digital twin, a detailed virtual model of an individual's biology that updates in real time as new health data flows in. These digital replicas could be used to simulate how a person might respond to a drug, a surgery, or a lifestyle change before they actually try it. That means doctors and scientists could test treatments in silico first, exploring how diseases might unfold and how to intervene early, potentially reshaping what we even mean by life sciences. The real promise: healthier, longer lives. Despite the futuristic flavor, the core ambition of the Internet of Beings does not have to be defeating aging altogether, as some transhumanist thinkers suggest. A more grounded goal is to make high-quality healthcare more widely accessible, not just for wealthy individuals or a few advanced hospitals. That could mean helping strained systems like the UK's National Health Service operate more efficiently, improving cancer detection and treatment, and extending these benefits to lower-income countries that currently struggle with basic medical infrastructure. If done well, these technologies could help more people enjoy longer lives with fewer years of disability, reducing the gap between lifespan, how long we live, and health span, how long we live in good health. Imagine rural communities where local clinics, equipped with Internet of Beings tools, can deliver personalized care that rivals top urban hospitals. The optimistic reading is that this is not about creating superhumans, but about lifting global health standards so that everyone has a better shot at living well. The nightmare: losing ourselves. Yet there is a darker side to all of this. turning human bodies into data sources and networks.